The toxic truth: how common medications can poison your liver. Drug-induced liver injury, DILI, is a significant concern in modern healthcare. It refers to liver damage caused by the use of medications, herbal supplements, and other substances. DILI can manifest as a range of liver-related abnormalities, from mild elevations in liver enzymes to severe liver failure. This article aims to provide a comprehensive understanding of drug-induced liver injury, including its causes, mechanisms, risk factors, clinical presentation, diagnosis, and management strategies. Causes and mechanisms. DILI can occur as a result of various medications and substances. Drugs with a known potential to cause liver injury include certain antibiotics, nonsteroidal anti-inflammatory drugs, NSAIDs, anti-epileptic drugs, statins, herbal supplements, and many others. The mechanisms underlying DILI are diverse and can involve direct hepatotoxicity, immune-mediated reactions, metabolic idiosyncrasies, and genetic factors. Types of drug-induced liver injury. DILI can be classified into different types based on its onset and characteristics. These include hepatocellular injury, cholestatic injury, mixed injury, and vascular/hepatic vein injury. Understanding the different types is essential for accurate diagnosis and appropriate management. Risk factors. Several factors increase the risk of developing DILI. These include advanced age, female gender, pre-existing liver disease, genetic predisposition, alcohol abuse, and certain drug interactions. Recognizing these risk factors can help identify individuals who may be more susceptible to DILI and guide medication choices and monitoring strategies. Clinical presentation. The clinical presentation of DILI varies widely, ranging from asymptomatic liver enzyme elevations to severe acute liver failure. Symptoms may include jaundice, fatigue, abdominal pain, nausea, vomiting, and loss of appetite. Prompt recognition of DILI symptoms is crucial for early intervention and preventing further liver damage. Diagnosis. Diagnosing DILI can be challenging as it requires a thorough evaluation of the patient's medical history, medication use, and exclusion of other potential causes of liver injury. Diagnostic tests include liver function tests, imaging studies, serological markers, and liver biopsy in certain cases. Collaboration between healthcare providers and a high index of suspicion are vital for accurate diagnosis. Management and treatment. Management of DILI involves discontinuation of the offending medication or substance and supportive care. In severe cases, hospitalization, monitoring of liver function, and interventions such as liver transplantation may be necessary. Identifying alternative medications, assessing potential rechallenge, and providing patient education regarding drug safety are essential components of managing DILI. Prevention and risk minimization. Preventing DILI involves careful medication selection, dose adjustment in patients with liver impairment, and patient education regarding potential risks and signs of liver injury. Healthcare providers and patients should be vigilant in monitoring liver function during drug therapy and promptly report any concerning symptoms. Research and future directions. Ongoing research aims to better understand the mechanisms of DILI, identify genetic markers for susceptibility, and develop predictive models to assess the hepatotoxicity of drugs. Improving our understanding of DILI will enable the development of safer medications and personalized approaches to minimize the risk of liver injury. Risk factors for DILI. Certain factors can increase the likelihood of developing DILI. These include the dose and duration of medication use, individual susceptibility, which can be influenced by genetics and underlying liver conditions, concomitant use of multiple medications, age, with older adults being more susceptible, and alcohol consumption. It's important for healthcare providers to consider these risk factors when prescribing medications. Drug-drug interactions. Drug interactions can play a significant role in DILI. Some medications, when used together, can increase the risk of liver injury. For example, combining certain antifungal medications with statins can potentiate the risk of DILI. It is crucial for healthcare providers to be aware of potential interactions and adjust medication regimens accordingly. Idiosyncratic versus predictable DILI. DILI can be classified into idiosyncratic and predictable types. Idiosyncratic DILI is rare, unpredictable, and unrelated to the dose of the medication. It occurs in a small subset of susceptible individuals and often has an immune-mediated component. Predictable DILI, on the other hand, is dose-dependent and more common. It typically occurs at higher doses or with prolonged use of certain medications. Hepatotoxicity monitoring. Monitoring liver function is important in patients at risk of DILI or those taking medications known to have hepatotoxic potential. Regular liver function tests, including measurement of liver enzymes such as alanine aminotransferase, ALT, and aspartate aminotransferase, AST, can help detect early signs of liver injury. Prompt identification of liver function abnormalities allows for timely intervention and medication adjustments. Herbal and dietary supplements. Herbal and dietary supplements are not exempt from causing DILI. These products are often perceived as natural and safe, but they can contain substances that have hepatotoxic potential. Patients should be educated about the potential risks associated with herbal and dietary supplements. And healthcare providers should inquire about their use during medication assessments. Regulatory oversight. Regulatory authorities play a crucial role in monitoring and addressing DILI risks. They review preclinical and clinical data to assess the hepatotoxic potential of medications before approval and continue surveillance post-marketing. Reporting adverse drug reactions, including cases of suspected DILI, to regulatory bodies is important for maintaining medication safety. Patient education and communication. Patient education is essential in preventing and managing DILI. Patients should be informed about the potential risks associated with medications, the importance of reporting any concerning symptoms promptly, and the need for regular monitoring of liver function when indicated. Clear communication between patients and healthcare providers promotes medication safety and early detection of liver injury. Emerging technologies. Advancements in technology are aiding the detection and characterization of DILI. Biomarkers, such as microRNAs and genetic markers, are being investigated to improve early diagnosis and predict the risk of DILI. Additionally, computational models and artificial intelligence algorithms are being developed to better predict drug-induced liver injury during the drug development process.